Valley seniors are being targeted. Some companies are taking advantage of them. We started working on this story back in June, but had to halt our investigation.
We were waiting to hear from the federal government. Tonight, News Channel 5's Eddie Flores tells us what he's learned over the course of this News Channel 5 investigation.
This investigation is about folks at adult daycares and durable medical equipment companies. They provide things like wheelchairs, walkers, and scooters for seniors. But according to our sources, they're taking advantage of the elderly here in the Valley just to make a buck. This elderly man is in his electric power chair. He needs one. The power chairs are provided by Medicare and are intended for senior citizens who absolutely have no other way of getting around.
Under the books and the guidelines, it specifically states they have to be bedbound, bedridden. They're uncompletely able to walk.
Meet Maria Infante. She's 72. As you can see, she's not only able to walk, she works in her yard and does other chores. But somewhere in her house, under a pile of clothes, we found this, an electric power chair. She's had it sitting in this corner since it was delivered 11 months ago. She can't even turn it on. Look, she says, a bag.
No, I haven't used it since they gave it to me. The man who dropped it off, I told him that right now I don't need it.
But what if the day comes when she really does need other kinds of equipment to get around? She'll be out of luck.
Once they get a motorized powered wheelchair, Medicare will not allow any more benefits. If they need a walker, a cane, if they need a bedside commode, they will not qualify or make any payments for any other equipment because they've already issued a power wheelchair.
Irma Gonzalez is the office manager for Dr. Raul Martinez in Edinburgh. She says Infante and others like her are getting the unneeded power chairs from crooked DME companies. She points the finger at this DME company, calling it, quote, the biggest culprit.
The name of the company is RGV Equipment Company.
Gonzalez says RGV DME LLC is able to pull it off by bypassing Medicare rules. Gonzalez says RGV DME LLC goes into adult daycares and gets seniors to sign up for a power chair. Gonzalez says her office repeatedly denies the request for power chairs served up by RGV DME LLC. They even go a step further and specifically write in big letters their patients do not need power chairs. Even so, she says the company continues to order the power chairs and delivers them to patients who don't need them.
Patients who are using them as cold wrecks at home. Patients who have small homes and they're not equipped for power wheelchairs. You're talking about a 500-600 pound chair. These patients are elderly. They have no way to even move the chair.
This man says he worked for RGV DME LLC. He's a whistleblower. He doesn't want his identity known because he still works in the medical industry. He says he quit working for RGV DME LLC after he found out about their questionable practices.
I still want to continue my career in the health field, and I don't want any part of it, so I brought it up. Nothing changed, and I left.
He tells us it's easy for the company to pull it off.
Once you get the Medicare card, you can bill anything you want to Medicare, and Medicare will pay you for it, and there's no justification for it.
And this billing business was booming. This whistleblower says while the company was paying Medicare about $700 to $800 for power chairs for folks who don't need them, like 58-year-old Flor Duran, they were getting reimbursed as much as $5,000 per power chair. He says 250 power chairs were given away in just 3 months, and the money quickly mounted.
When I first got there, there was a report that was floating around, and the report said that they had maybe generated about $1.8 million in just in power chairs and on fraudulent billing before and while I was there.
He says he knew what the company was doing was against the law.
He was getting billed automatically without any consideration of what the doctor has to say. Illegally. Pretty much illegally, right.
We went to another DME company here in the Valley, and they told us it's all done electronically.
They're inputting the code as if they have a valid doctor's order, but since they don't have a valid doctor's order, they shouldn't be billing for the item in the first place. So that's where the fraud comes in.
They're able to get away with it because Medicare doesn't ask to see a signed doctor's form. The only way they can check is to physically come to a DME company and check the patient's file themselves.
I think this is fraud.
Ofelia Munguia is the director of the Rio Grande Adult Daycare.
I've had clients been given a wheelchair that have Alzheimer's. How could you expect a client with Alzheimer's to work a wheelchair?
So we took what we found to RGV DME LLC to see what they had to say. We asked to show the manager some of what we had on videotape.
Tell her it is detrimental that she see this tape. And I have this right here. All I need to do is plug it in, not say a word, and just let her look at it.
But we were told the manager didn't want to see the tape. 15 minutes later, the owner arrived and took us to his office. He refused to look at the tape as well and told us to call his lawyer. So we did. You're not going to talk with us at all? And you don't want to look at the tape. As the lawyer, you do not want to look at the tape. He said he would get back with us on the matter. The government is cracking down. We've learned that DME companies will be required to become accredited by the federal government by September of 2009. That means they will all have to abide by much stricter guidelines in order to do business. But until then, some DME companies will likely continue to take advantage of the Medicare system and the elderly. Eddie Flores, News Channel 5 at 10.
Now, we did talk to a spokesperson with the Centers for Medicare and Medicaid Services. They work to identify fraud and egregious activity that take advantage of Medicare programs.
And while he could not speak about any specific cases they may be investigating in the Valley, he did say the Valley is a hotbed for Medicare fraud.
You're correct. They're in South Texas as well as Miami, and in areas in California and New York. There are areas that have been identified where egregious behavior has been rampant.
If you think you might be aware of any kind of Medicare fraud, we'd like to hear from you. You can email us when you visit our website at www.newschannel5.tv, or you can call the News Channel 5 tips line at 1-866-797-TIPS.